Hello everyone, today we're going to be discussing how much the UK is doing to address mental health in young people. So firstly, we're going to start off with a Menti poll to see initially, without delving much into the topic, how much you think the UK is doing to promote mental health. So this will be ranked from 1 to 10, 1 being barely doing anything or 10 being that the UK does a lot. Why do we need to address mental health? Mental health, according to the World Health Organization, is your emotional, psychological, and social well being, affecting how you think, feel, and act, influencing how you handle stress, relate to others, and make choices. Hence, it has a big social impact and tolerance over our lives. It can affect our relationships, work life, to even physical health. For example, it can increase risk of diabetes, respiratory issues, or trigger physical symptoms like fatigue, pain, and digestive problems. Now that we know why it is important to take care of our mental health, let's think about the factors or triggers that can impact it. For example, life events such as stress, trauma, or loss. Biological factors, for example, your brain chemistry or genetics. Or it could be socioeconomical issue. Statistically, it has been proven that the biggest trigger impacting mental health in the UK is financial insecurity, followed by work-related stress, which links with the lifestyle factor. So what is already out there? The NHS website has many helplines and guidances, as you can see on this slide, on how to navigate your mental health struggles. I'll be passing on to the next speaker for further information.
In terms of services and initiatives in place, the NHS is quite a big service as they provide mental health support teams, also known as MHSTs, and also children and adolescents mental health services, also known as CAMHS. MHSTs were created by the NHS to offer early intervention, low intensity mental health support within schools and colleges for children and young people with mild to moderate mental health difficulty, such as low mood, anxiety, and behavioral difficulty. They also provide advice to education setting staff on how to identify the most appropriate services for students' needs. The MHSTs are also able to refer students to the Children and Adolescents Mental Health Services (CAMHS). The CAMHS is where young people are able to receive more specialist support as they deal with a wider range of mental health problems. They also provide treatment such as cognitive behavioral therapy, known as CBT, group therapy, creative therapy, where they use arts such as music and painting to explore feelings. Apart from talking therapies and art therapies, young people may also be prescribed medicine by a professional or inpatient hospital care. Professionals who work in these sectors vary from doctors to psychotherapists, clinical psychologists, and registered mental health nurses. Both MHSTs and CAMHS are spread across nationally, with the Midlands having the largest number of MHSTs, with 140 spread across the region. Apart from the NHS, a charity called Young Minds also helps support young people by offering information and advice. Their main purpose is to stop young people's mental health reaching crisis point, so they have a helpline where they offer practical tips, reassurance, and advice for young people and also their carers. Another initiative that offers similar services is Kooth and the NSPCC. Kooth is an online platform where young people can create an anonymous profile and open up to a professional mental health practitioner using a live chat. On their website, they also promote activities to boost well-being. The NSPCC is also another online platform that offers advice and resources on how to improve one's well-being. They also run a childline service for young people to provide counselling sessions for them. In 2020, the initiative also partnered up with the University of Birmingham by funding a research program that will enable experts to explore effective help and support, especially to children who are at risk of suicide. Place to Be is another mental health charity, and they go into schools to provide mental health support through one-to-one and group counselling using tried and tested methods backed by research. They aim to provide a safe space for young people to talk about what is on their mind. The last charity I will be talking about is the Mental Health Foundation. This charity provides lots of resources to support schools, education staff, caregivers, and young people. For example, they provide schools with assembly-ready slides to promote young people opening up about how they feel and to normalise mental health. Thank you.
There are various mental health challenges facing the youth in our current society. These challenges include anxiety and depression, eating disorders, self-harm and suicidal thoughts, and loneliness. Next slide, please. So, anxiety and depression. Anxiety is a constant feeling of fear, unease, or worry about something that may happen in the future. Everyone feels a bit anxious from time to time, but anxiety becomes a mental health condition when it refuses to leave. However, depression is a mental health condition where the patient experiences persistently low mood or loss of interest in their life. According to some statistics I got off some websites, 1 in 3 people, that's 34%, aged 18 to 24, which is the youth, are reporting symptoms of mental disorders, for example, anxiety and/or depression. This figure rises to 41% in young women. In the image to the right-hand side, you can see some symptoms according to the Psychiatric Associates of depression and anxiety, and it rules out the differences, and then some that overlap with each other, and some of depression are sadness, worthlessness, irritability, thoughts of suicide or death, while anxiety, some of them are trembling, feeling nervous or powerless, and elevated heart rate. Next slide, please. So, eating disorders. An eating disorder is a mental health condition where you use the control of food to cope with feelings and other situations. This occurs by having unhealthy eating behaviors, which may include eating too much or too little, or worrying about your weight or body shape. And this could be like because of stress, because of jobs and financial insecurity. And according to the NHS, anyone can get an eating disorder, but it is more prevalent in teenagers and young adults. There are some types of eating disorders, quite a few to be honest. In the image you can see a few there. Anorexia nervosa, bulimia nervosa, binge eating disorder, that's eating too much, avoidance restrictive food intake disorder, otherwise known as ARFID, and picker. Next slide, please. As a disclaimer, before I continue onto this slide, I would advise that because this is a triggering topic, if you feel that this might be quite this might be something you don't want to hear, you could leave and then come back after like 1 minute or 1.5, so you don't get disturbed by the content on the slide. Thank you. So, self-harm and suicidal thoughts. Self-harm or self-injury describes a wide range of things people deliberately do to themselves that appear to be harmful, but usually do not kill them. Self-harm quite literally is trying to harm yourself. It is not usually a failed attempt at suicide, but it can still be very hard for parents or carers to witness. However, suicidal thoughts are general thoughts about not wanting to be here, making a plan about how and when the person could end their life. They might also feel less like you want to die and more that you want the pain of whatever the person is going through to stop. According to some statistics, 1 in 4 people have suicidal thoughts, 1 in 10 people self-harm, and 1 in 13 people attempt suicide. And there, on the image to the right, there are some warning signs that people could look for of suicide in like people close to them or colleagues at work or in school. And that's like talking about wanting to die, great guilt or shame, and then feeling empty, hopeless, trapped, and such things like that. Next slide, please. And then the last one is loneliness. Loneliness is quite subjective. It's quite subjective to the person who wants to define it because it might be really personal to an individual. According to the NHS, I think, to minds.org, loneliness could be described as a feeling experienced when our need or desire for social contact and relationships are not met. Loneliness is increasingly prevalent in the youth due to various factors like physical isolation, moving to a new location, or death of a loved one, or through online platforms where the individual experiences online bullying, and it really impacts the person to the point that they start to possibly have anxiety or depression and in the loop. That's all I've got. Thank you.
Okay, so sorry about that. So some MMI style questions for this on the topic of mental health. Would need you to use critical thinking to give reasonable suggestions to the interviewer, depending on what the question is. And the interviewer also is looking at your reasoning skills and ability to think on your feet, as whatever question they give you might not be as straightforward as you might anticipate, but it would involve mental health in some way. So an example question, which I would ask for a volunteer to maybe have an attempt at answering, is how do you think the current mental health crisis in the UK affects the overall healthcare system? So if I could have a volunteer to answer, that'd be great. Potential points here. So these are a few points that you might want to keep in mind. So mental health crisis in the UK places significant strain on the wider healthcare system, not just on mental health services, which is the focus of the question. So limited access to specialist mental health care can lead patients to present to A&E, which is not designed to provide ongoing mental health support. And as you might know already from your wider reading, there's a lot of strain already on emergency care and A&E in particular, with lots of targets not being met. Definitely very oversubscribed, the waiting times being many hours. So having people presenting to A&E with mental health issues that can't really be addressed there just creates greater backlog and more strain on that system. Increased, so that's just, as I said, explaining those that's third point as well. Then primary care services, particularly GPs, have a rise in patients with mental health concerns, including first-time presentations and relapses. So again, primary care is an area where we see quite a bit of shortages, and having a mental health crisis definitely puts some more strain on that. So that might be people having mental health issues for the first time, as well as those experiencing it recurrently as well. And then these increased demands can have longer appointment times, and then affect other conditions that need to be managed in those settings. And as we've already seen from these two examples, this pressure on one part of the system can create knock-on effects across the NHS. So it's always important to remember when you're giving your answers in MI scenarios that the healthcare services are very interconnected, and it's important to have well-funded, accessible mental health services so that they don't put strain on other services such as emergency services and primary care. Here are a few more examples of MI style questions that you might want to practice formulating answers to, and a few on the next slide as well. Yep, so just to think about those, because a lot of them won't be specifically just you stating your knowledge, but would require you to actually apply it in a particular scenario. For example, thinking about how a healthcare professional working in a mental health setting might face challenges, or seeing how COVID had an impact on the mental health crisis as well, and how we could prevent that happening in the future.